Another good Sunday to you, Monica. We have some grim words from the Surgeon General today. What else did he say as this country is entering a very critical time for slowing this virus?
A very intense warning, Alex, from the Surgeon General, comparing the days and weeks ahead to a potential Pearl Harbor moment, a 9/11 moment in terms of its severity, really warning Americans that what is to come is absolutely going to be worse than what we have seen so far. And so he stressed the importance of making your own face masks at home, and he actually demonstrated and showed people how to do that if they haven't done so already. That's notable because the president, of course, says he's not going to be doing that himself. But as the Surgeon General laid out how intense these moments are going to be, he also said that if this is the lowest of the low, that means something good has to come on the other side of it, trying to look ahead. Take a listen to that from this morning.
This is going to be the hardest and the saddest week of most Americans' lives. I want Americans to understand that as hard as this week is going to be, there is a light at the end of the tunnel if everyone does their part for the next 30 days.
Note the word everyone there. The Surgeon General also had a warning for the governors who in their states have not yet declared stay-at-home orders. There's only a handful left of those. We're hoping to hear more today as the thinking continues about what they're going to do in those particular states, because as the Surgeon General laid out, if everybody doesn't participate in the social distancing, in wearing face masks that you make at home, if you absolutely have to go out in public, it doesn't matter the efforts as much of other people. Everybody really has to do their part. They couldn't be stressing this in a more serious way, Alex. It's a more intense tone than we've heard in even recent days from the top health officials here at the White House.
Indeed it is. Okay, Monica Alba at the White House, thank you for that. Well, joining me now, NBC News medical contributor Dr. Natalie Azar and NBC News medical contributor Dr. Kavita Patel. She is also the former health policy director for the Obama administration. Welcome, ladies, to both of you. Dr. Patel, you first here. We just heard some good and some bad. There's potentially light at the end of the tunnel, as stated by the Surgeon General, Jerome Adams, but also that this may be one of the saddest and hardest weeks for Americans, this week that we are entering into right now, comparing things to Pearl Harbor, 9/11. What do you make of that comparison? Do you think it's going to get that bad?
Absolutely, Alex, and probably not just for this week, but for the next several weeks. And that's simply because we're tracking cities all across the country and the doubling rates, and especially in neighborhoods in Detroit, New Orleans, Dallas, we're finding that the delays in testing and stay-at-home orders are now kind of catching up with us. So this is going to be probably not just a devastating week, Alex, but probably several weeks, because we'll see this rippling through the United States.
Okay. Dr. Azar, you were probably listening to Governor Cuomo with his latest news conference saying that the numbers are coming down to the ICU, those being admitted into ICU, and up for the numbers of being released from the hospital. Interpret that. What's that mean?
Yeah, Alex, and I think, but it's important for people to recognize, too, that a change from one day to the next is not as significant as a pattern. I will say that it is true that for the last number of days, or I think probably close to a week now, the rate of hospitalization, the rate of doubling, I should say, has gone down in hospitals across the New York area anyway. But certainly we want to see the number of ICU admissions decreasing, hospitalizations decreasing, and discharges increasing. Again, it's not so much a day-to-day change, but rather a pattern that I think is going to inform whether or not we are in fact seeing that plateau that we are all, hoping to get to sooner rather than later.
Absolutely. And Dr. Patel, in terms of these numbers, does that mean that the critical shortage of ventilators can be somewhat diffused? I mean, does it mean if you don't have as many people coming into the ICU that you may not need as many ventilators?
It's possible, but Alex, here's the problem. I mean, we're still talking about, a 20% hospitalization rate and somewhere near a 3% fatality or death rate. And the truth is that when these patients come in the ER and they crash hard. And so you never want to be in a situation where you have, quote, just enough. And I think that's why you heard Governor Edwards, Governor Pritzker, and many others say, please send us help.
Yeah. And Dr. Azar, when you talk about a patient that has crashed, how likely is it that a patient gets a little bit better and then gets a lot worse? I anecdotally have heard about that from friends of mine who've gotten through on the other side of the coronavirus all around the world. They had a day that they were feeling a little bit better, and then the next day awful.
Right. And so this is all part of what we're starting to understand about this disease. And we wrote about it about a week and a half ago. It's something called the slow burn. And that is that, it starts off kind of indolently, where can't tell if you have a flu or a cold, sort of, aches and pains and low grade fever. And that really, I think, reflects that we know that the virus has a real affinity for the upper respiratory tract, so the nose and the throat area. And in folks who start to get into trouble, it's when the virus, I don't want to lose you. It's when the virus starts to travel down the larger airway and into the lungs and causes pneumonia. And anecdotally, from doctors who've been on the front line who treat this, they say that patients present themselves within the first 48 to 72 hours. Are they going to get really sick and crash and require intubation, or is their trajectory looking better? So again, as we get more case reports and case series and start to really understand the evolution of this disease, we can better monitor patients more closely in that critical time period. This information actually came out from the very first case series in Wuhan, where they showed that the shortness of breath happened at 5 days and respiratory distress requiring intensive care happened around day 7, 8, and 9. So this is playing out exactly as we saw back then. And it's very much informs the way we manage these patients.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.